Okay, we'll call this meeting to order. It's Wednesday, January 10th, 2024, and we're here to hear from Panhandle Health Quarterly Meeting from Don Duffy. And I'll go ahead and turn it over to Don.
All right, Commissioners, thank you for allowing us to come up here today. And as you know, we're going to do what we normally do, is just kind of go over some updates with the Health District and kind of what's happening. It's just to give you an idea of what's going on. And I've invited Dan Perry with me today. He oversees our Senior Companion Program, and that's a program that's in all 5 counties. And when I'm done, if it's okay, I'm going to give Dan just a few minutes to go over that program,
Okay.
which is one that we do have up here in Shoshone County and the value of that. So what's going on with the Health District? Wow, probably the biggest thing right now is the LUMA transition. LUMA is an ERP system. That stands for Enterprise Resource Planning. Basically, the state changed their accounting, payroll, HR system. After using the same system for 30 years, they now have a new system that's called LUMA. That will begin implementation on July 1. And it has been a challenge. This is no reflection on the state at all. But, you know, anytime you're with an accounting system for 20 to 30 years and you make I'm probably exaggerating that, it's probably 15 to 20. When you make a change like that, it's going to be troublesome, and it has been. We're making good progress, but like just recently, we were able to start to print reports to make sure that we're in line with our budget and all of that. So it's getting much better, but there's still some things to work out. We do see some real advantages with the LUMA system. Certainly, I think efficiencies will eventually come, but honestly, that's probably a year out for us to really understand. You know, sometimes when you have a system that's so complex, it has great opportunities for efficiency, but it takes time.
Yep, it takes time.
So we're working through that. We're doing much better job on invoicing and reporting. HR has gone relatively well. Everyone's getting paid, which is so important to us. As an entity independent of the state, we could go and get our own system. And, you know, we have pondered that from time to time, but first of all, the costs would be immense, and also just another transition may not be to our best interest.
Exactly.
So we're charging ahead. There is one other of the 7 health districts that has said they are going to switch to a new system. I believe that's a little myopic. I think we need to just trudge on through, and we'll be where we need to be eventually. So just to kind of let you know, that's what's happening. And my next topic ties to that, and that is we have our FY25 budget. We're just now beginning putting those things together. Our fiscal year begins on July 1. As you know, we've talked about this with you before. And so we start in January ramping up to get that budget ready, to the point that by the end of March, we have a draft budget prepared. Well, that's the challenge with LUMA is will they have all the reports? And really, we need reports from a historic perspective. We obviously have good reports up through June of 2023. That fiscal year is available because that was on the previous system. But getting the 6 months since July 1 is important to us. That historic perspective is important as we budget out for all of our programs. So a little challenging. We think we're going to be fine, but the budget season is coming. And just to notify you that is occurring. You know, if you have any thoughts about that, we'd sure be willing to hear you out regarding our budget going forward. But the process will be the same as it's always been. We will hopefully we'll present a draft budget to the Board of Health at the end of March. And then our next meeting with you, our next quarterly meeting, will be presenting to you that budget. Again, not for your vote, just as a review. And then at the end of May is our budget hearing, where representatives from each one of the counties come down and cast a vote for the budget. So just to understand that process. But this is a busy time for us as we get that budget together. Let's see, what else can I share with you today? We had our meeting on Friday, getting close to finalizing our calendar year strategic plan. What are some of the lead goals for us going forward? And one that I was just going to mention is that we hope to do better training for our Board of Health members. We really would like to see our Board of Health members more engaged in the processes that we do. And I take responsibility for that. So at our Board of Health meetings, we're going to discuss when we meet next week about doing a little snippet of training in each one of our Board of Health meetings, so that our Board of Health members are feeling confident in the responsibilities that they have. Part of that objective that I set for myself was I will also be meeting individually with each one of our Board of Health members. So this would be Tracy, just to meet with them once every 6 months individually to see if they have any questions or concerns about our Board of Health. And finally, the third objective is that I will be sending to them our draft agenda for each Board of Health meeting before it gets finalized. Right now, just the chair sees that draft. We would like Tracy, for example, to see that so that she can make changes on it if she feels to add something to the agenda or get more involved that way. So overall, hoping that those three objectives will get our Board of Health members more involved in our processes going forward. Just a little bit about, the diseases that we're working with. Influenza is on the rise, influenza A. And that's very common this time of year. We see that rising. We feel like that'll probably peak close to the end of this month and drop like it always. We look historically, that's been the process. RSV, which of course is very challenging for our little ones as well as senior adults, that seems to have reached a stable plateau and probably will be dropping as well. For whatever reason, we always talk about COVID. That's been on the rise, not near to what it was in the past. 2 weeks ago, there were 21 people in Kootenai Health with COVID, none of them on ventilators. And as of today, I think the report I saw this morning, there was 4. But COVID is still out there. It will always be out there. And as a country, we're still losing 200 people a day to COVID throughout the country. And that's much less than it was, but something that's just become part of public health to monitor that where we can. Not anything we can really do about that. And finally, I was just going to mention to you that I mentioned a moment ago about our strategic plan. Our strategic plan is driven by what we call our community health assessment, or our CHA. We do, every 5 years, we do a very extensive community health assessment with multiple community partners. Hi, Tracy. How are you?
Sorry, I was stuck in the assessor's office.
Well, happy to have you. How have you been?
Good.
Good. So we were just going over our community health assessment, and that we do this once every 5 years, and we are with multiple community partners, including partners here in the Silla Valley. Shoshone Medical Center was very much involved in this process to determine what are the needs that our community sees from a health perspective. And then once the health district knows that, that's the foundation of our strategic plan. We're not just following the money, we're following the needs of our community. And here are the key things that came up from that. One, these aren't in order of priority, but one was access to care. That's a challenge for a lot of people. Even the expansion for Medicaid helped some, but a lot it didn't. And so access to care is a key one. And that's certainly medical providers, it's transportation, cost of healthcare services, all fall under access to care. And I bet these wouldn't surprise any of these that I'm going to mention, but behavioral health for adults, for youth and adults, is a significant issue in our community. mental health provider availability, crisis intervention, recovery services, substance use, mental health education all fall under that. If you have Medicaid and you need a mental health provider, there's chances are you're going to wait 3 to 6 months to see one.
Mhm.
It's really awful.
It's
And if you have good insurance, you can see them almost within a week. But Medicaid is so complicated to be a provider, and then added on that, they pay half of any other insurance. Mental health providers are saying, well, we can fill our practice with Blue Cross patients. Why would I contract with Medicaid? So it's a real challenge in our community. And so you'll see the health district coming up with some plans to, at least in small ways, address that area. Another concern of our community were older adults, and Dan's going to talk about that here in a minute, but memory care, in-home care, some of these services that are lacking. And then there's the social determinants of health. We know about this. Housing, for one, is a crisis in all areas, including in the Silver Valley. Healthy food and nutrition and transportation. I was just speaking with Colleen, and I forget her last name. And she's working on a grant to get better transportation in the Silver Valley, which we're supporting. And then finally, youth services is one. Child care, after school care, health education, kids dealing with housing shortages and so forth. Lots of youth services issues. We had the opportunity a couple of weeks ago to tour Children's Village and out in Coeur d'Alene. It's incredible the number of kids that just do not have a reliable parent or guardian in our area. It's almost shocking, from little kids to teenagers. So that's an area that came out of our CHA. So what I did do, this is a long document, but I am giving you a copy, and I only have one here. Okay. But this is going to come out in a much more formal format, but I thought I would just give you this as kind of the initial one. But really that will drive a lot. And then Tracy, at our meeting in March, our next Board of Health meeting, we contracted out with a company called Crescendo to conduct our community health assessment. And they are going to be writing a 30-minute presentation on this document. So you're going to get a lot more information and better information than what I was able to provide you today. So any questions at all? I've rambled on for a little bit. Anybody at all?
I did hear you say that COVID's normal and slowing down, right?
Yeah, it's certainly, Commissioner, it has picked up over the holidays. Some suggest that's because so many were indoors, but we are seeing that sliding down. And we measure that in several different ways, but the best way is we get it out of water treatment. We actually check the water level, we can find elements of COVID in treatment facilities. And that is really becoming the best way around the country to get an idea of where COVID is. And we're finding that's dropping here and in other areas of the country as well.
Okay, because I've had it once for the year, and I'd like to be done, so that's good news.
Yeah, that's for sure. Those that, it's interesting. We do have a vaccine out. Very few people have taken advantage of the newest COVID vaccine. And what we're really learning is that the vaccine won't necessarily prevent you from getting COVID, but it will prevent you from getting really sick from COVID. And time will tell if that's accurate or not. But those that are getting it are getting pretty sick, for sure.
Thank you. Thank you for the update.
You betcha. Anything else?
No.
Commissioners?
no.
Okay, if I can turn a little time over to Mr. Perry.
Okay.
Thank you, Don. Good morning, Commissioners. Thank you for the opportunity. You're no doubt aware of the growing population in North Idaho. Really, the growth and the needs that it's bringing is outpacing so much of our resources. 12% of those moving here are over the age of 65. You won't find them out protesting or marching in streets, carrying placards, campaigning for their needs. Many of them suffer in silence. They're often unseen, unheard, and you have a number of people here in Shoshone County that are in that state where they have limited resources, very few family members, they're not connected much with community, and so they need help, primarily with socialization and getting them to their medical appointments, and store shopping is needed. Don mentioned about having access. Well, this is very true, especially for our senior population. Well, since 1987, Panhandle Health District has had in place a program called the Senior Companions Program of North Idaho. And what we do in part at no cost to clients, there's no income scale. We provide that socialization. We provide a friendly visit into the home with our volunteers that help them stay connected to community. And we also provide them with transportation to their medical appointments, and store shopping is needed, thus enabling them to live more independently in their home where they're at right now, keep them from having to move into more very costly skilled care, assisted care, now memory care. Our program has had a tremendous impact. And what we're doing and what we've done for the last 27 years, it just can't be overstated, the need and the void that it's filling. Last year, our volunteers served more than 30,000 hours, drove more than 135,000 miles in service to clients throughout the entire Panhandle, all 5 counties. Within Shoshone County, we currently have only 7 volunteers that cover the entire county, and we have only about a dozen clients. One of the reasons that we're wanting to come and meet with you folks is to provide some awareness. We don't want to be the best kept secret in North Idaho. We want both commissions and city councils and the population to know there's a program here, a vital program that's helping seniors in our community at no cost, a very cost-effective program. We receive a federal grant that provides our volunteers with a stipend, a reimbursement for their time and their mileage. So it's unique that volunteerism is actually paid volunteerism. It's non-taxable, non-reportable income. So for our volunteers who have to be 55 and older, that's sort of an incentive to provide them with some disposable income each month, which with the rising cost of living here in North Idaho, that's very beneficial to our seniors. And on the other hand, you have seniors as clients that are needing the help, that can't get out, that are unlimited income and resources, that we're able to minister to these folks in a very special way, a couple of times a week, and help them. The other thing about Idaho is we are ranking 15th in the country, projected increase in dementia cases. Between today and next year, there's to be a 22% increase in cognitive-related, dementia-related issues. And the disease is growing exponentially here in North Idaho for whatever reason. Just in Kootenai County alone, there are 400 people on the wait list just to be evaluated. And so this issue is growing in North Idaho that we can address as well through the Senior Companions Program, because we're able to provide respite care to the caregivers of loved ones who have dementia, Alzheimer's, or other terminal diseases. So our program is here, it's in place, it's existed for, as I say, 27 years. But what we need to do to keep pace with really the growing community of seniors in North Idaho, and many of those, 1 out of 4 is isolated, who have these other medical issues, need access, need transportation. We need to collaborate, network, and partner with our county commissioners, our city councils, to promote program awareness within the county. We're already networking with Shoshone Medical Center and many other places, but it's like if we only have 12 clients in Shoshone County, that's not even called scratching the surface.
There's a lot more that needed.
Yes. So we need to recruit more volunteers and expand that in order to serve more clients. And these clients who are unheard, they're unseen, they're here in Shoshone County. How can we reach them? So we want to collaborate with you folks. And we think elected officials is one of the ways that we can do that to make the program more aware within, their area where they're serving. And then also for their support. We need your backing. Appreciate your backing the Panhandle Health District, and the budget part of that budget helps us continue this program. And it's a vital program. So I'm the advocate. I'm the pitch man. I'm the driver, wear many hats. But because that I see in the next several years, the senior population, the baby boomers, we call it the silver tsunami or the white tsunami in some cases, it's upon us.
Yeah.
It's here. And we need to address the issues of our senior population as they get older, have cognitive issues, and getting them socialized and staying in their own home, and getting them to their medical appointments. Shopping's a very important thing, groceries and so forth. And that's what we're doing. And we want to expand that in Wallace, Osborne, Silverton, Kellogg, entire Shoshone County. There are these rural places out here that, there's needs there as well. So I put together a little bullet point for you there. You also have a rack card, gives you information about the program. This is pretty much for recruiting of volunteers. On the back side of the bullet point is more of a client recruitment to let clients know that we're here, we can help at no cost. Our volunteers do a great job. They're trained, they're clear, background checked. They do phenomenal in helping the clients of Shoshone County staying in their own homes and remaining independent. So, any questions I might answer about the Senior Companion Program?
Do you struggle getting volunteers?
Yes. It's a big challenge. Especially there's a piece of the program that volunteers have to qualify income. They need to be low-income seniors. I think the thinking of the federal government is that we want to reach low-income clients who can't afford transportation and people to come in, and we want to incentivize senior volunteers to help these folks. So it's seniors helping seniors. But they do put a cap on income eligibility.
For the volunteers?
Yes. Yes. We're working with that. Thankfully, Don's been instrumental. In the last several months, we've met with staff of representatives in D.C. To get this on their radar, on the agenda, to address this. We're at 200% of poverty. You can't be above that. We'd like that moved to 400%. It's interesting. There's a correlation between the growth in North Idaho and the cost of living in North Idaho with recruitment, because we have people moving here that are well over income, but they want to volunteer and they can't.
Yeah.
And so the people that are qualifying income, they can no longer live here and they're moving out. Oh. So it's a challenge to recruit volunteers. It truly is. So we're hoping that in due time, sooner than later, that the feds, because it's Congress that controls this and changes this, to move it from 200% to 400% of poverty would bring us up in the area of $60,000 a year for a single person. And if I had that, I would not have turned away 25 people in the last year. Wow. I would have 25 more people a day were it not for income eligibility. So it's an issue. It's a challenge, Tracy, to recruit. But we're doing well. We're at about 50 volunteers right now. Ideally, with our current client base, which is about 135 clients throughout the district, that's good. The more volunteers we have, the more clients we can have. And I think we all realize there's far more than 135 clients in all 5 counties that can use this program. So we need to expand. And expansion comes through, I think, awareness and promotion of the program. So I thank you so much for your time.
Thank you.
Thank you.
Appreciate it, especially at my age. I need to keep my options open.
Anything else, Commissioner? Any questions for us? That's what we really hope for when we come.
Any
to these.
ideas on getting the awareness out there?
We're on social media. We're in the newspapers. For some reason, seniors gravitate towards Nicholsworth, and I run an ad in Nicholsworth. There's more promotion perhaps in Kootenai County because of the base, larger volunteer base and client base, but through our hospital systems, doctor offices, the VA, we work closely with them, social workers, senior sites, meal sites. We've been all over trying to spread the word that Senior Companions Program is here, and but for whatever reason, we just don't seem to have. We need that little umph to our try. Okay? That makes sense.
Well, Dan does a great job. He does. He uses every avenue. He's a little modest here. He's using every avenue he possibly can to get the word out. But for our purpose with you is, you as commissioners are talking to people all the time.
Mm-hmm.
And it's kind of that grassroots effort is what we're looking for. If you're talking to a group of seniors, or you get a question about a senior issue, or direct them to Dan.
Okay.
That's what we're asking you to do. Nothing
That's why I
special
want to know
here.
what we can do to help. Yeah.
It's if you really look back on, you talk to more groups than I do, and I think, and individually you're talking to people, and in your own personal lives you know people, and we're just asking you to be aware of this. If you have anyone that you might think even slightly needs the services of Senior Companion, or would like to be or might qualify for a volunteer, send it Dan's way, and we'll take it from there.
Yes.
That's really what we're asking of the three of you.
All right. Absolutely.
Any further questions?
No.
No? Commissioner Dose?
No,
No?
no, thank you.
Well, we'll adjourn this meeting. I appreciate you guys coming, and
Thank you for the opportunity.